Hello, I'm Etienne Schnur, Scientific Advisor at Ceramics and Biological Dentistry Foundation. Dental implants have evolved into a common and predictable treatment option for reconstruction of edentulous spaces. Criteria such as implant survival, marginal bone stability, absence of pain, inflammation, mobility no longer define success. There is an increasing aesthetic demand and expectation of the patients for a natural-looking soft tissue peri-implant, and these are important criteria for achieving success. Along these lines, the presence of papillae, the height of peri-implant buccal mucosa, as well as soft tissue color, texture, and convexity are critical aspects that affect the aesthetic of implant-supported restorations. Soft tissue complications, such as here seen around titanium implants, bring an unacceptable outcome, and that's why we focus the study of the month today in 5 critical topics to succeed in management of soft tissues. Number 1, consider the peri-implant mucosa dimensions. That means the transmucosa part of the implant with its vertical and horizontal components, as seen here around SDS ceramic implants after 6 months of immediate implantation. Number 2, soft tissue healing and osseointegration are mediated by molecular events and triggered by the interaction between host cells and the surface of the implant. In this line, we must consider osteoimmunology, topography, and the philicity of the implant system. The oral soft tissue wound healing undergoes a highly ordered biological process which comprises the following overlapping phases. Phase 1, hemostasis and inflammation, with the formation of a clot, recruitment of inflammation cells, which links to the second phase, proliferative, on the vascular network restoration and epithelial regeneration, and the phase 3, remodeling, with the differentiation of fibroblasts and myofibroblasts, type 3 collagen and type 1 collagen, and wound healing. In general, a thick mucosa, as thick the mucosa as less the bone loss in a follow-up of 1 year, but consider that not always horizontal thickness of the soft tissue represent a sign of success, as it can also increase due to peri-implant disease or as a compensation, for instance, in a buccal bone defect. Number 3, augmentation. Studies have shown that better results, static results, consider filling the gap between the implant and the bone buccal wall as a preventive measure to avoid the buccal tissue recession. Here you can see we fill the gap using PRF matrix. Number 4, axial position of the implants. The horizontal distance between implants and tooth must respect a minimum of 2 millimeters or 3 millimeters in between implants for anterior maxilla. And with the advancement of digital implantology, the risks are reduced, as we can set plan implant position and parallelism. Here an example of SDS box, as well as the AIM-guided surgery. Or another solution would be using different shape of implants, as here the SDS oval shape placed in front in scissors, or the balcony implant, where 2 implants would not fit properly. And number 5, papilla height. A complete papilla around a single implant is expected when the vertical distance between the crestal bone and the contact point of the restoration is less than 5 millimeters. The papilla height between implant and a natural teeth is also highly dependent at clinical attachment level of the neighborhood teeth. As conclusions, mucosa dimension and papilla filling adjacent implants are factors that can predict aesthetic outcomes after immediate implantation, and on the other hand, the presence of a thin gingival phenotype, presence of peri-implantitis or buccal position of the implant represent factors that can cause buccal tissue recession. Thank you very much for your attention.